Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256 for the best OET coaching, and subscribe our channel if you have not. Thank you so much, and please watch the video till end, and please watch each video 2-3 times so that you can understand, because it is very important to watch one video 3 times. Don't watch my 3 videos one time. Watch my one video 3 times, you will have more benefits. So this is a small letter, and sorry for this paper is little tilted, but again, I'm not worried about the paper. I just want to tell you how to do OET letter. Just a very small introduction. देखो इतना बड़ा letter भी आ सकता है. Such a big letter can come. If you will write all the letter, all the words of this letter, it will easily take you to 250 words. But that is where you need to understand कि इस letter में कुछ ना कुछ, in this letter there would be something different. So in this letter, if I talk, using the information, write a letter to Samantha Bruin, senior nurse at Grey Walls Nursing Home. That means I am writing the letter to a senior nurse who is working at nursing home. And what is the name of the nursing home? Grey Walls. Who will be responsible for Mr. Baker's continued care? Continued care means ongoing care. So continued care, matlab whatever the care we have provided in the hospital, similar kind of care is required to be continued after discharge. तो बेसिकली जैसी केयर हम हॉस्पिटल में कर रहे हैं वही केयर देनी है, कंटिन्यूड केयर. लेट अस सी. सो गुड मोबिलिटी, weight bearing with the help of Willy Walker, post operative disorientation regarding time. This is the current assessment. And then HB got dropped. It is not important because HB got stable, और यहाँ पे HB की कोई बात नहीं हुई है. तो as the things, again, sorry, I'm taking little haywire, but please इस recording को 3 बार सुनना. That is why I'm telling you to listen to this recording 3 times. Like in this case, HB dropped and then it became stable, so it is not required. But over here it is given ongoing monitoring is required. So that is you need to include in discharge plan. Otherwise you should not write this plan because it is not given in the discharge plan. But this extra line, ongoing monitoring required. So that is where it says iske karan se we have to include this data, otherwise we could have ignored it. Then ongoing monitoring mein yahi hai, ongoing monitoring required for anemia. Monitor medications. So this person must be taking some medications in the nursing plan. So there is nothing nothing about medication. No. Okay. And then there is anesthetic also, continued observation. So this letter is little different in a way. ये letter इसलिए लगा है क्योंकि normally nursing management होता है और discharge plan होता है, assessment नहीं दिया होता. So इस letter में मुझे time देना ही पड़ेगा, मैं जल्दी में नहीं कर सकता. I'm really sorry. So I will take it step by step. नहीं तो मैं आपको confuse कर दूंगा, तो मुझे आपको confuse नहीं करना है. I'm really sorry. हम दोबारा से शुरू करते हैं. तो जल्दी करने का कोई फायदा नहीं है, सीखने का ही फायदा है. So I'm just going to take 15 minutes rather than 5 minutes. Senior nurse, Grey Wall Nursing Home. So Grey Wall, who will be responsible for taking care for the continued care. Continued care में क्या क्या करना है? Monitor medications, preserve skin integrity, continued exercise program. Equipment required are these, जिनमें से hospital will organize. Hospital has organized razor, मतलब ये 3 instrument, 3 equipment चाहिए. Willy Walker, pillow and razor. Razor has been arranged by the hospital. And hospital to provide walker and pillow, sorry, hospital is arranging these two, and the toilet razor needs to be arranged by the social worker from the local medical supplier. So these are the important points of the discharge plan. So discharge plan के main point है monitor medications, preserve skin integrity, continue exercise program. So these are the only 3 points. These are the extra points, but we will do it later. Let us try to understand the letter first. Letter says, Gerald Bakra, 79-year-old patient on the ward in a hospital. You are a charge nurse. Okay, he's 79-year-old patient and we are the charge nurse. Widower, 3rd September he was admitted to our hospital. 7th September he was discharged. So totally he stayed in our hospital for 4 days. There he came to the hospital for total hip replacement. Ongoing high blood pressure is one of the symptoms. It is not the diagnosis. And also you should not say he was diagnosed with hip replacement. It does not look nice. So in this letter, I will tell you what to write, but I want to tell you the main point. This is the main point I want to discuss. This is the point. If you miss in the exam, you will not pass. If you will understand this point, you will pass. Lives at Grey Wall Nursing Home. This is the main point I want to discuss. And हम letter किसको लिख रहे हैं? To whom we are writing the letter? Grey Wall Nursing Home senior nurse. That means the patient lives at this home since last 4 years. That means the patient is going back to the nursing home. That is why it becomes a discharge back letter. As soon as it becomes discharge back letter, then social history and medical history should not be included. There is no requirement. So that is where data selection is done. So whenever there is lot of data given, please try to use your mind. It can be discharge back letter, it can be referred back letter, or it can be a letter where these things will not matter. So in this kind of a letter, when patient lives at Grewal nursing home and we are writing the letter to the senior nurse at Grewal nursing home, so what you can do about it, you can make it very simple. I'm just going to take you there. Yesterday we were discussing about the grammar, so I'm just going to rub it off. And now I will write the first paragraph for you. Okay. Now I will write the first paragraph for you. And you will see how easy it is. Just make it simple. So for the first paragraph, you do not need to know the complete letter. What you need to know is who is the patient, why did he come? Again, I mentioned these 3 points. Again, I would write it. Why did he come? What was the treatment? And what's the progress? And then comes the third line in the first paragraph, most important line, purpose of the letter. These are the 3 points you should write in the first paragraph. So now I will write these 3 points. This letter, this is the most important paragraph to pass exam, OET exam. So just this paragraph, this letter is being written regarding your resident. This is the main punch of this letter because you are writing to the Grewal nursing home and patient lives at nursing home. So I am writing this letter. Yeah, this letter is being written regarding one of your residents. Mr. Baker, who was admitted to our hospital. Now we should not write the word diagnosis, who were admitted to our hospital for total hip replacement. So now Grewal nursing home senior nurse will read this letter and she will understand, okay, this is the letter regarding Mr. Baker, who is our resident. So this is all good. And she knows that the patient went for total hip replacement. So let's see the rest of the part of the letter. Now I want to know what was the treatment. Obviously total hip replacement would have been done, and what's the progress. So to know the progress, I have to read the letter. So osteoarthritis requiring total hip replacement surgery that was diagnosed in 2008. And what is the current date? 2010. So 2 years ago. 2 years ago he was found with osteoarthritis जिसके लिए total hip replacement चाहिए थी. इनमें से मुझे कुछ नहीं चाहिए. इनमें से मुझे कुछ नहीं चाहिए. I don't need anything from it. Medications I don't need at the moment, but aspirin, ramipril and Panadol, these are the 3 medications which are going on. Nursing management and progress. So this will tell me what is the progress. Daily dressing were done, range of motion, occupational therapy, hip replacement. After hip replacement, daily dressing was done. Range of motion including stretching and strengthening exercises were encouraged. Occupational therapy was given. Staples, this is not what I want. So these 3 points I want. Daily dressing was done. Range of motion exercises were started. Now the assessment is that patient is having good mobility. Patient is able to bear the weight. Patient is having good mobility. Patient is able to bear the weight. So this is the current condition. So that means there is a progress after the hip replacement. So this is the progress, that good mobility and he can bear the weight. So now when I have to write in the first paragraph, I say after surgery, after acquired treatment or after surgery, hip replacement surgery. After surgery, his condition is better and he has started walking. But with the help of Willy Walker. That was given now, but with the help of Willy Walker. He has started walking, but with the use of Willy Walker. So I'm just trying to make my language, but with the help of Willy Walker. So the thing that I want to say is Mr. Baker, who was admitted to our after surgery, his condition is better and he has started walking. But even if you do not write this line, it will not make difference. So I want to say his condition is better, but he needs continued care. So that is the main point that was given in the last. So use only this thing. So that is what I say. Why did he come? Hip replacement surgery. What is the treatment after surgery? What is the progress? His condition is better. Now the purpose. But he needs continued care. या आप ऐसा कह सकते हो. His condition is better. So he is being discharged back to your nursing home. So this is the best way. Because when patient is better, so he will go back to the nursing home. This is the discharge back letter. So that is where the point is covered. So one of the punch of this letter is one of your residents. Second punch of the letter is he is being discharged back to your nursing home. Once he reaches there, you are advised, because इनको हम advice दे सकते हैं because these are the nursing home. So you are advised to provide him continued care for speedy recovery. So that is the point we want to tell. So in the first paragraph, it is not necessary to explain everything, that what is the current condition, whether patient can walk or not. But this is the way of writing the first paragraph. This is the only thing they want. Why did he come? Hip replacement. What is the treatment? Surgery. Condition is better, so he's being discharged back. Last line, once he reaches there, you are advised to provide him continued care for speedy recovery. So this is the perfect way. No hanky pankies. Don't make it difficult. Listen to this video 2-3 times. You will automatically pass. Now, the things which are confusing you, which are actually becoming dilemma, which is actually causing dilemma to you, means you are getting confused. These are not important. Suppose the first dilemma you have is ongoing high blood pressure. Then in the then this osteoarthritis वाली line, बाकी तो हमने छोड़ ही दिया है. Hypertension है, ongoing management, osteoarthritis. Then daily dressings were done. So if we are dicey, we are confused about this point, how to write these 2 points. So let's see if in the nursing management we did anything. Nah. We did not do anything for osteoarthritis. Hip replacement we have already done. So good mobility. So now please, this is the point where I want you to think like I am thinking. This is where you should take a deep breath. Take a deep breath in your exam. Don't rush. Don't rush. So what I want to say is, now this is confusing me. This is confusing me. Where should I write it? So I don't know what to do. So I will make it simple. I will use this during hospitalization, after surgery. Dressing was done. So you can make it that simple that you can simply start the second paragraph during hospitalization. Yeah, after surgery. You can simply write after surgery. Simple. Now you are just forget the social history and medical history because they already know about it. This is not the main point that you have to write osteoarthritis. You have to write jabardasti about the medication. So simple, write after surgery. Daily dressings were done during hospitalization. So you can make it otherwise. During hospitalization को बाद में लिख दो, क्योंकि आपको relate करना है ना. You have to relate it with the first paragraph. So you can say after surgery, daily dressings were done on incision site. जैसे आप incision site लिखोगे तो during hospitalization आपको important नहीं लगेगा क्योंकि लाइन लंबी होगी है. It's all good. Now you are in the rhythm. Now try to write easy lines. Range of motion, stretching and strengthening exercises were commenced. ठीक है. So after surgery, daily dressings were done and range of motion exercises, again simple passive voices, were commenced, which included stretching and strengthening exercise. Even this is not important, but this, I know English, I want to gain marks. So that is why I am saying, because why am I writing this point of exercises? Why am I writing this paragraph of exercises? Because in my discharge plan, it says continue exercise program. So if I will use the word continue exercise program, I need to tell what kind of exercises were started. So my whole data selection depends upon this thing. My whole data selection depends upon this thing. यहाँ पे क्या क्या है? And यहाँ पे to preserve skin integrity. That is why I said daily dressing. And I will also use staple wala line. I will also use this line of staples because we need to preserve the skin integrity. So it is according to discharge plan always that you will select data in discharge wala letters. In discharge letters, data is always selected, whether it is a discharge back letter or a simple discharge letter. This is the main purpose. This is the main purpose. So that is why it says monitor medication spent in Ford. So I might write about this thing as well. But right now, if I write, it will spoil my rhythm. So I am not writing this line right now. I'm focusing on this thing. This also I will teach you how to write about medications. Okay. So now this aspirin and this, okay. And aspirin was not given in the, aspirin was given earlier. Aspirin was, no, hypertension के लिए वैसे तो ले रहा होगा aspirin, but it is not given anywhere. So I should not use it anyhow. So it is confusing me. Basically, I will not write anything that is confusing me. Again, coming back to the basics, I was telling you about this thing. So yeah, after surgery, daily dressings were done and comma and range of motion exercises were commenced, which included this and this strengthening exercises. Done. So my other line, and देखना word count will automatically get complete. This is what confirms me कि इससे ज़्यादा नहीं लिखना. Don't have to write anything more than this in OET. This is about word count. So now getting to the second line. Occupational therapy was started and staples need to be removed after 2 weeks. This I will say later on. Good mobility. So yeah. Strengthening exercises, but there is nothing important in this. Good mobility post-operation. So okay. So the patient, as a result, this is the line I would like to connect. Means surgery के बाद daily dressing was done and exercises were initiated. Now I want to use same kind of line. As a result, because of the exercises means as a result, तो patient की good mobility हो गई. So as a result, the patient had good mobility after operation. Exercise के कारण ही हुआ ना. So I said this line. As a result, he had good mobility after the operation. He could bear the weight. Now I want to tell his progress. He could bear the weight with the use of Willy walkers. Okay. Along with that, I am writing in the past. Otherwise, I will say along with this. In the past, I say that. Along with that, he could bear the weight. And could walk ward of length without difficulty. So this is the current condition. That is what senior nurse at Grewal Nursing Home, who is waiting for his patient to come back, her patient to come back. That is what he or she wants to know. That surgery was done. What is the current condition? So this is what is important. That exercises were done. Patient had good mobility after operation. So that is what she wants to know about the patient. Along with that, he could bear the weight and could walk. It is past. So can ki jagah could walk ward of length without difficulty. Okay. I can also write this thing in the present. That is not a problem. Patient post-operative disorientation regarding time and place during recovery, possibly relating to the continued observation recommended. So these are the discharge plans now. So now I would write the discharge plan. Means I will make 2 paragraphs of discharge plan. That is where I am segregating the data. That is where I will try to make it simpler. You would have written little difficult. I am trying to tell simple method. Post-operative discharge. Mr. Baker, just to change the heading, post-operative disorientation regarding place and time, which might be due to anesthetic effect. So continued observation is recommended. Simple. So that is the recommended, is required, is advised, is recommended. What it wants to say by this point, that it can be due to anesthesia, or maybe the patient is having some other problem. Maybe he had some mental trauma. So that is why this might is there, that it is not 100% due to anesthesia. That is why continued observation is advised after discharge. So that is what this main points. Dekho. Possibly means maybe. But the patient had disorientation regarding time. So continued observation is advised. Further, his HB got dropped, but with the help of blood transfusion, it is now I'm turning into present. It is stable now. So his HP got dropped. I'm writing just those points. Because that is what senior nurse wants to know, what she needs to do. So I'm not getting into social history, medical history, any data that is confusing me. I'm not writing anything. I want to make OET the simplest exam of the world. I want to score 350. Trust me, I should not name the girl. There is a girl who called me up today from Delhi. I don't know whether I should take her name, but I won't take her name. And she called up in the morning. I have also passed on, if you will check my status today, I have uploaded her remarks she gave me on WhatsApp. She said, sir, I took OET 2 times. I did not pass writing the first time. The second time, my teacher told me that you should not fill the exam. You are not ready. Then just 4 days ago, I found your videos on YouTube and I scored 390. And it was so overwhelming for me. And she said, I followed all your instructions. I just listened to your 5 or 6 letters, but I listened to those letters 3 times. So she listened to these kind of letters, these kind of instructions 3 times, 6 letters, and she could score 390. The problem is that you guys, when you listen to me, I'm not talking to my YouTube followers and not to every student of mine, but जिनको problem आ रही है, जिनको प्रॉब्लम आ रही है उनको प्रॉब्लम ये आ रही है कि वो इस बात पे ट्रस्ट नहीं, द पीपल आर नॉट trusting on these things. The simple you will make OET, the higher marks you will get. So what I am doing, I am not using any confusing data. I am just thinking to write an email to senior Grewal nursing nurse. So I am just thinking about senior nurse. So what she needs is not medical history. What she needs is not social history. What she needs is not medications. She needs these things. What happened with my patient? What is the things that she has to monitor? So she has to monitor these things. Continued observation. As patient was disoriented, further his HP got dropped. It is stable now. However, it's still, because it is given, that is what senior nurse has to do. Ongoing monitoring is required. However, continued monitoring or ongoing monitoring for anemia is required. So this is the main purpose यार, बस ये बात समझ लो, पर्पस के हिसाब से लेटर बनाना है. Don't think डाटा क्या दिया, पर्पस के हिसाब से सोचो. Now the last, it would also be greatly appreciated. Also word, why did I, this is my samajhdari. This is my sensibility. Why I'm using also? Because I have already given to instruction 1, 2. So it would also be greatly appreciated. दो चीजें तो आपको करनी है. इसके अलावा, apart from this, it would also be greatly appreciated if you could, and please check my status today, you will get to know that girl was so overwhelming, and I was so happy to receive her call that without, obviously she studied from English medium. She didn't know about the pattern. That is why she failed in the first attempt. Her English that you are taking coaching for grammar. When you take coaching, your grammar, your other reasons. But if you want to know the pattern, then this is the pattern. Just follow this pattern. Think like कि senior ग्रेवाल senior nurse को क्या चाहिए, जिसका पहले पेशेंट है. Why would she be interested in social history? हमें लगता है, we feel like we should write social history, medical history to leave an impression. But senior nurse को नहीं चाहिए, क्योंकि वो वहीं पे तो रहती है पेशेंट के साथ, उसको पता है. So don't write those things which are not. Please try to understand the gist of OET, purpose of OET. So it would be greatly appreciated. Now the first point is given, if you could monitor the medications Panadin 4. And this is Panadin 4 to QID PRN. So if you could monitor the medication Panadin 4, which was, now I am writing, which was given QID. Now I am using that data, which was given QID, which was given as per requirement, PRN means as per requirement. I do not want to use this line, to be very honest. If it would have been my exam, I would have skipped this line, but I would have done कि ये वाला point लिखता preserve. So I would have written, if you could preserve the skin integrity and please note that the sutures will be removed after 2 weeks. Now this is my समझदारी. Skin integrity वाली बात को मैंने इसके साथ लिखना था. That is why I hold on to this thing. If you could preserve the skin integrity, and please note that the sutures will be removed after 2 weeks. That was given. So I have used this data from here to preserve the skin. Exercise program should be continued. And medication chart is being enclosed with the letter. So continued as well, because I want to make this line big. So medication chart is being enclosed with the letter. So kindly monitor her medications as well. Medication as per prescription. अब देखो वो पॉइंट जो मेरे को सबसे ज्यादा तंग कर रहा था, medication, that is where I have written लास्ट में प्लीज नोट करके भी लिख सकते थे, लेकिन प्लीज नोट मैंने यहाँ पे यूज कर लिया था. दैट इज वाई आई डिड नॉट यूज इट अगेन. बट अगर मैं यहाँ पे प्लीज नोट नहीं यूज करना चाहता तो मैं ऐसे भी लिख सकता हूँ, इट इज इम्पोर्टेंट. ऐसे भी लिख सकते हैं, इट इज इम्पोर्टेंट, या सिंपल ये भी ठीक है. मेडिकेशन चार्ट इज बीइंग एनक्लोज्ड, सो मॉनिटर हर medications as per prescription. So that is the point, वो Panadin वाला covered. Now let us count the words. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 200 words. And in OET, we are allowed to write 180 to 200 words. By this I want to tell you, इससे ज्यादा आप कुछ भी लिखते हो वो नहीं चाहिए. ये इस बात का प्रूफ है. दिस इज द एविडेंस कि 200 वर्ड्स पूरे हो रहे हैं. अगर आपका ज्यादा ही मन थोड़ा बहुत, इफ यू फील लाइक आई वांट टू राइट ऑस्टियोआर्थराइटिस सर, You know, it's very important. So आप यहाँ पे लिख सकते थे, as you know, she was having osteoarthritis, but then you are making letter complex. But अगर आप लिखना चाहते हो तो I'm teaching you, as you know, she was having osteoarthritis, due to which hip replacement was required. Therefore, during hospitalization, तो 2 साल बाद hip replacement was done. Therefore, she underwent hip replacement. But again, I am making it difficult. आप समझो. Therefore, she underwent hip replacement. Please try to understand this scenario. First of all, she already knows about it. कि hip replacement क्यों चाहिए था. Senior nurse already knows the patient is having osteoarthritis. So why do you want to make your letter complex? Why don't you feel like passing it easily? Discharge back letter, you are writing it here, na? One of your residents, you are getting the points of discharge back, then you are writing discharge back. So these are the 2 punches of your letter. Why do you want to make it complex? Make it simple. After surgery, daily dressing were done, which included this. As a result, अब देखो letter को पढ़ के देखते. Let's अब हमने we have done so much of hard work, and also the good point that girl told me from Delhi. That was a very good point. Sir, I completed my letter in 20 minutes in exam. I had, and that is what I always tell you. Total minutes we have been talking to each other right now, even after teaching you, is 25 minutes. That is what I'm telling you. OET letter does not take more than 25 minutes. Only precaution, do not write anything that is confusing you. You will save your time. Write according to the person to whom you are writing the letter. You will save your time. You will save your words. You will have better marks. You will have less chances of grammatical mistake. Now I will read the letter. You will see कहीं पे भी grammar complex नहीं हुई, कहीं पे भी letter complex नहीं होगा और पूरा समझ आएगा. अब समझो कि आप nurse हो. Now consider yourself as a nurse of the patient. This letter is being written regarding one of your resident, Mr. Baker, who was admitted to our hospital for total. After surgery, so he is being discharged back to your nursing home. Once he reaches there, you are advised to provide him continued care. After surgery, daily dressings were done on the physician and range of marks were commenced, which included this. As a result, he had good mobility after the operation. Along with that, he could bear the weight and could work without difficulty. Mr. Baker had post-operative disorientation regarding time, so continued observation is advised. Further, his HP got dropped, but with the help of blood transfusion, it is stable now. However, ongoing monitoring is still required. It would be greatly appreciated if you could preserve the skin integrity, and please note that the sutures will be removed after 2 weeks. Exercise program should be continued as well. यहाँ पे along with this, because I have words ना, मैं लिख सकता हूँ. मेरे पास word count कम हुआ है. Along with this, exercise program should be continued as well. अब ये flow में आ गया. दोबारा पढ़ता हूँ. It would be if you could preserve, and please note that the suture will be along with this exercise should be continued as well. Medication chart is being enclosed with the letter, so monitor her medications as per the prescription. ये कभी नहीं लिखना 2 words. This is your letter. और 1 second में examiner would be able to read it. वो ऐसे कहेगा आपको 390, कहेगा वाओ, कोई complexity नहीं, message भी सारा मिल गया. Continued observation, ongoing monitoring for HB, for anemia, ongoing monitoring for anemia is required. Sorry. Message delivered. If you could preserve the skin integrity, please note sutures will be removed. Exercise program should be continued. Continued why? Because we initiated that program during the hospitalization. Medication chart is being enclosed. So all the medications, now all the medications, which I was confused about, aspirin, Ramapin, all the medications are there. So please, so medication chart is, so monitor her medications. Yeah, give her medications as per prescription. That is what was given. So this is the best way of writing OET and passing OET exam. Make it simple, please. That is what I am trying to tell you again and again. That is what, when people call me up, you know, that was the first call I attended in the morning. And I was so happy that, you know, it is not difficult at all. That is what I'm teaching you again and again. If you will pick difficult data, you will be in trouble. If you will pick easy data, then your grammar will be easy, your word count will be easy, your letter will be in flow. बस थोड़ी थोड़ी छोटी छोटी चीजें करनी है, स्मॉल थिंग्स आर इंपॉर्टेंट. जैसे यहाँ पे होल्ड ऑन करना है, मॉनिटर मेडिकेशंस को बाद में लिख देंगे, जो आपको कंफ्यूज कर रहा है उसको बाद के लिए छोड़ो. डेली ड्रेसिंग वाज डन, सूचर्स हैं, स्किन इंटेग्रिटी को प्रिजर्व करना है, इंसिशन साइड पे ड्रेसिंग हो रही थी. तो यही पॉइंट, दिस इज द पॉइंट व्हिच आई मेंशनड आफ्टर सर्जरी डेली ऑन इंसिशन साइड. And that is where I said, please preserve the skin integrity of incision site and please note suture will be removed after 2 weeks. So I've given all the information. Patient had good mobility, so patient could walk. But HB गिरा था, anemia के लिए monitoring करना है. So this is the best type. And total minutes we have taken to talk to each other is almost 33 minutes. In exam, you will have 45 minutes. So that is what I am telling you, all the things will get linear. मतलब सब कुछ अपनी जगह पे अरेंज हो जाएगा. आपका पेपर में टाइम भी बचेगा, ग्रामर भी बचेगी, एफर्ट भी बचेगा. जब एक बार आपको समझ आ जाएगा कि लिखना सिर्फ वही है जो जिसके हिसाब से आप लेटर लिख रहे हो, सिर्फ वो. जैसे ही the moment you get into this thing now, you are in trouble. When you think about medications, when you think about this osteoarthritis, when you think about this Greyville nursing home, when you think about this ongoing, this is what is causing the trouble. Please do not write anything that is troubling you. This is spoiling your letters fluency. आपका काम मुश्किल कर रहा है. आसान लिखो, अच्छा लिखो. लास्ट में अगर वर्ड काउंट पूरा नहीं होता, लास्ट में इफ वर्ड काउंट बाय चांस इज नॉट कंप्लीट, तो जो चीज आपको तंग कर रही थी, प्लीज, सॉरी, जो भी चीज लास्ट में तंग कर रही थी, एज यू ऑल्सो नो, आपको ये तो पता ही है, शी इज नॉन केस ऑफ, या शी इज हाइपरटेंसिव. So please continue those medications. So please continue the medication. So please monitor her for the same. अगर दिया होता तो, अगर आप कंफ्यूज होते तो, पर ऐसा कुछ दिया ही नहीं लास्ट में. लेकिन अगर दिया होता, इसके अलावा भी हमारे पास अभी भी डाटा है. आपको पता है टॉयलेट रेजर वाली लाइन, अभी भी हमने लाइन मिस की है. सोचो अगर वो वर्ड भी आप लिखोगे तो इसका मतलब ये लाइन एक्स्ट्रा ही है, ये लाइन एक्स्ट्रा ही है. तो अभी भी हमारे पास डाटा बचा है, ये वाला इक्विपमेंट रिक्वायर्ड, तो इसको भी अब पूरा मत लिखो. सो द पेशेंट नीड्स विली वॉकर, जो भी है, विली वॉकर, कोमा बी एंड सी, which should be arranged as well. मतलब मैंने छोटा कर दिया, which should be arranged. तो अब मैं यहाँ पे as well पे खत्म करना चाहता हूँ. as well is the best way of completing the letter. तो मुझे यहाँ से as well उठाना पड़ेगा. यहाँ से उठा देते हैं. The patient need Willy Walker which should be arranged as well. तो ये मेरा लास्ट पॉइंट, अगर आप लिखना चाहते हैं A, B and C चाहिए which should be arranged as well. अगर आप ये कहना चाहते हो हो चुके हैं अरेंज, इससे कोई फर्क नहीं पड़ेगा. अरेंज हो चुके हैं which has been arranged as well. लेकिन जैसे ही आप हैज बीन लिखते हो, एज सुन एज यू राइट हैज बीन, मतलब कि हो चुके हैं, तो जो चीज हो चुकी है उसको लिखने की क्या जरूरत है, मत लिखो. इसीलिए तो मैंने सोचा ना लिखूं, तो क्या फर्क पड़ता है, कोई फर्क नहीं पड़ता. इससे अच्छी लाइन मेरी मेडिकेशन वाली है. सो अगेन, एक लाइन के लिखने ना लिखने से कोई फर्क नहीं पड़ेगा. चाहे आप मेडिकेशन वाली लाइन लिख दो, चाहे आप ये शुड बी अरेंज्ड वाली लाइन लिख दो, इट विल नॉट मेक अ डिफरेंस. अगर आपने लेटर अच्छा लिखा है, बढ़िया लिखा है, ही विल पास यू. वो ये थोड़ी कहेगा आपने ये वाली लाइन नहीं लिखी, मेरे को तो वो वाली लाइन चाहिए थी. अगर आप अच्छा लिखोगे तो आपको, चाहे आप मेडिकेशन वाली लाइन लिख दो, चाहे आप विली वॉकर वाली, चाहे दोनों लिख दो, यू स्टिल विल पास. अगर वर्ड काउंट पूरा होता है तो दोनों मत लिखो, कोई दिक्कत नहीं. पर लेटर का वर्ड काउंट पूरा होगा तो एग्जामिनर को पता लगेगा आपने अच्छे से किया है. वर्ड काउंट कम है तो इसका मतलब कुछ रह गया है, तो वो पकड़ लेगा, फिर वो ढूंढेगा क्या नहीं लिखा. फिर जब वो क्वेश्चन पेपर को उठाएगा, फिर वो कहेगा अच्छा मेडिकेशन वाली बात भी नहीं लिखी, विली वॉकर वाली बात भी नहीं लिखी. लेकिन अगर आप इनमें से एक बात लिखोगे और आपका वर्ड काउंट पूरा होगा, तो वो ओवर चेक नहीं करेगा, वो आपसे खुश होगा, वो आपको 350 से ऊपर देगा ही देगा. सो प्लीज लिसन टू दिस वीडियो वंस मोर. कोई बात नहीं, आई नो यार टाइम नहीं है आपके पास, दूसरा मॉड्यूल मत करो, लेकिन ये काम की वीडियो है डिस्चार्ज बैक लेटर के लिए। प्लीज लिसन टू इट 2 टाइम्स एटलीस्ट। अगर 3 बार देख सकते हो अप टू यू, लिख के देख सकते हो, वेरी गुड, आपका ही फायदा है। सो दिस इज डॉक्टर भूपेश फ्रॉम डॉक्टर BKM Institute. Our contact number is 7696734 256. Thank you.